Hey, you guys, I wanted to come on here really quick because I wanted to share this story about when I was a new grad. And I went through this horrific experience at this hospital that I worked at with some of the nurses there. And so I had to go do a travel assignment early in my nursing career. We're talking about, oh God, maybe 18 years ago. And I had to go do this assignment because my first hospital had closed down. And so I got caught up in the 2008 recession. So even though they promised me that the debt was paid for the hospital, I got a call 3 months after I started working and I got laid off. Anyway, I go into this hospital, first travel assignment, so let me try it. Didn't know what it was gonna be like, and so I'm working overnight, 7 p to 7 a. And so my preceptor, I was supposed to be with her like 3 to 4 weeks. She was very good to me. But after 2.5 weeks, she said, Audra, you look like you got this. You think you're ready to fly on your own? I said, let me try it. So I was in med surg telemetry at the time, and my hardest part of med surg telemetry was the telemetry class because I thought that I had to know all of the abnormal rhythms, which really was not true. I just needed to know when the patient wasn't in normal sinus rhythm. But nevertheless, um, I went on, and every night that I worked with this one RN. I would always speak to people when I came in. Good evening, how you doing? Hello. Even introduce myself. She would look right past me. She never would speak to me. Well, we ended up working side by side at the nursing station together every single time I worked until I realized like my schedule and her schedule, they were identical. So I'm sitting there and I had come in one night. I had already did my assessments. I gave out my pain medication, whatever IV push I had to do, whatever IV antibiotics I had to hang. And then around about 3 in the morning, we both ended up at the nurses station and we were doing chart checks. And that's when we were in the book with the mark. So I finally got that down packed, checking orders. I finally learned how to follow a doctor and learn his chicken scratch. Because in school, I was like, did they teach all of them to write in chicken scratch? So, like, if somebody gets sued, they can't tell their handwriting. But anyway, I was able to figure out the chicken scratch, and so I was happy. I could just feel her up my spine watching me. She would always just watch me, and if I got up, did you need something? I was like, no, is there a problem? You know, or if I went to go do something, she just would appear. And you could tell that she was waiting for me to mess up. So she didn't speak to me, didn't speak to me. And so I didn't really know that the hospital had really more LPNs than RNs at the time. At that particular time, you know how they go through waves. Sometimes, oh, LPNs can't come to the hospital. Y'all can't hang IVs. And then when they need you, oh, LPNs, come on in, come on in. It's just a mess. A nurse is a nurse, So one night, so I caught her one time. She was talking to this male nurse about me, and I was coming down the hall. And when I got up close on them, she turned around and she tried to grin and say, oh, hey, Audra, how you doing? So all of a sudden you're speaking to me, but I could overhear you talking to him about me. Well, what she was talking to him about was another instance that happened. I ended up taking care of a cancer patient, and cancer patients, they're in a lot of pain. So at that particular time, the cancer patient was on a PCA pump, a pain controlled analgesic pump where they push the button and they think that they're getting pain meds, but it's really time because I've already set the machine according to the doctor's order. So what happened was, he's on the PCA pump. He also had something for breakthrough. I think it was Percocet. I had already given him his Percocet, but what a lot of people don't know about sick people or people who are on hospice or whatever, the family is going through like a grieving process, and the family will get very upset because they see their loved one in pain. Why was I in there? I had just went into the room and given him some Percocet, went back to the station to sit down to do my work. Why do I get this lady standing in front of me talking about, you're a horrible nurse. You don't know what you're doing. And you have my husband in pain. You should be terminated. And you know what I did? I got right up, went and hit the button for security, and I walked away politely. And I sat in my faith. This lady is screaming at me. She has come to ask me, hi, I'm Miss So-and-so. I'm his wife. Could you give me an update on him? When is he due for pain medication? Can you give him something else? He seems to be in a lot of pain. I was giving him everything I could give him. You understand me? You know what I'm saying? There was nothing else that I could give him, but she didn't even come and talk to me. So she was yelling at me. So I went on about my business. She was irate. And when I went on about my business, what happened was security came and they checked her. Okay. So what happened was that kind of alerted the nurse and all the other nurses on the floor. So the minute that security hit the floor, y'all, why did this lady put on the waterworks and start crying? Yeah, because that thing go both ways. That goes both ways, okay? I was just an employee. I was just doing my job. You already convicted me, and I'm not going to get into all of that. You understand me? But there's a protocol and a policy to how you act in a hospital, and it goes both ways. It goes for the patients and their family, and it goes for me, the licensed registered nurse. So now, since that all happened, people were asking questions and they were whispering, the nurses were whispering, so I don't know, and da, 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 da. So my supervisor came up and she asked me, Audra, what happened? I told her what happened. And guess what the supervisor did? At this time, I was still very blinded to the fact that supervisors actually will fix things, because that's how I grew up. In the 70s and the 80s, your supervisor was supportive and they actually came to the floor to fix things and to help you and to support you. Do you need anything? How you doing, Audra? You okay? Do you need a lunch break yet? Okay, well, let me know. Now it's not like that. So the supervisor, she took in what I said, and then she literally, y'all, just went in the room, and after she looked at the doctor's order, she gave pain medication. So you know what I'm saying? So that appeased the patient, but because I called security, and this was in the policies, and I read the policies and procedure. I was present at orientation. It was in the policies that if anybody comes in the hospital and they become irate or they appear to be a threat to staff and or patient, you call security. That's why they dealt with her. You know what I mean? They checked her. They was going to walk that lady out of there. So, the nurses started, talking about it, trying to get information from me. And I wasn't going to tell them all my information because half of y'all don't even like me, so that's what I overheard this one nurse talking about, when I walked down the hall. I could hear her say, oh yeah, and guess what? And mind you, I didn't say she had a crush on this nurse. He wasn't paying her no mind, and I'm not going to go into the details as well, but she was like, yeah, she called security, trying to paint me out to be a bad nurse, whatever. So we continued to work together. She used to love when it would be my turn to get an admission. And in med-surg telemetry, any setting, you could be focused on your med pass, which they clearly say you have a 2-hour window to do. But if you have an admission, they never have those admissions time. Now, 20 years later, I know why admissions aren't timed. You just have to do them when they come. So she would always come to me and say, Audra, you have an admission. I'd be like, okay, just let me know when it gets to the floor and I'll take care of it. And I took care of all my admissions, but she loved it, especially on nights when I had more than one admission. Oh my God, she loved it. She loved that. So Continued to work with her and continued to work with her. She continued to just wait for me to mess up, waiting for me to mess up. And so, fortunately, I never messed up except one time. And I talked about that in another video, but it worked out well, And one night I get to work and I'm just trotting along, gathering, my little paperwork and getting everything together, printing out my labs, whatever, whatever. And she comes to me in a humble manner. And we are in front of the bedboard. And she's like, Audra, she says, well, 4 RNs called out tonight. She said, so I'm the only other RN and you're the only other RN. So you're going to have to be charge nurse with me tonight. I said, okay, just let me know if you need anything. You see that? And I don't even know to this day whether I really was supposed to be charge nurse with her. I didn't, ask the supervisor. I didn't validate what she said. I just trusted, we're all professionals. I don't think she would be coming to me saying that I am going to have to be, charged with her if that is not true. And so I didn't even know what to do as a charge nurse at that time, but I knew if I read doctor's orders and I took care of patients and I looked at the mark correctly and I did my assessment and I made sure I paid attention to my call lights and I made sure everybody was alive, that I guess I was being charged, But anyway, let me get to the other part of this hospital. So I also worked with LPNs in there, like I told you guys. So this one LPN in this hospital at this particular time, the RN had to hang IVs for the LPN. Well, you got to understand the LPN has her own patient load. So she has her own medical record that shows when she has to have those IVs hung. So common sense and the policies state you have to let the RN know when your IV needs to be hung. Like, guess what she would do? It used to be these little nursing stations like in the hall, and then my med card would be in the hall, on my side where my patients were. And I would be going around doing my rounds, doing assessments or whatever. And all I know is I will always come back to my med card and like 2 or 3 IVs would be IV bags would be sitting there of antibiotics, Levaquin, all kinds of stuff. So I never could understand why didn't she just come to me and say when they needed to be hung. But in my logical brain of brains, I said if it's late, it ain't gonna be Audra's fault. You know what I'm saying? So I did some investigating. I knew what LPN it was. So I decided when I go back to work, me and her gonna have a little conversation. So the conversation went like this. She was another one, never spoke to me, looked straight through me. She looked at me as if I was like gum on the bottom of her shoe. And so I called her when I went into work one day, went in early. I said, can we have a conversation before we start tonight? I said, I noticed that every night I work, when I come back to my med card, there are several of your IV bags for your patients sitting on my med card. I said, but you know that the policy is that you have to have these hung by me at a certain time. She's looking at me, just staring, really don't want to acknowledge me. I don't know why. And she's like, I said, so this is what I'm going to need you to do. I'm going to need you to come to me before every IV that you need to be hung, because one of your IVs, had I not called it in time the other night, would have been late. You understand me? And that's for the patient. That's not for me. Okay? And so I told her that. I said, if your IVs are sitting on my med card and you have not communicated to me that they need to be hung, I'm going to have to follow through with the appropriate procedure. And I left it like that. So next night I work with her, same thing. IV sitting on the cart. So I went to the nurse manager and I said, could you tell me what your email address is, please? You already know how this go. This going down in writing. You understand me? So I got on my break. I sent that email to the nurse manager and I said to her, XYZ, blah, blah, blah. On these many instances, on these dates, this is what happened. She left these IVs on my car. I've had a conversation with her, and she still continues to do it. And I said, although your policy is not that she has to speak to me when I come in, I said, but we all professionals. I said, and she never acknowledges me. I said, but we have to work together. I said, and this is not working for me. So next thing I know, when I come into work, every time I came into work after that, why was Mrs. Lolly L waiting for me at my med cart with the IVs? That's all, you guys, for today. That's the end of the video. Stand your ground in nursing. Know the rules, know the policies, procedure, follow the standards of care, follow the Nurse Practice Act, and check anybody that try to undercut you. Have a good day. Bye.